All right, moving on. We have one more speaker before our panel of speakers. So I would like to introduce Margaret Cheng, who is the clinical coordinator of the Beatrice Welters Breast Health Outreach and Navigation Program here at Perlmutter Cancer Center. And she's going to talk to us today about how to ask for help and the role of supportive services.
Great. I think that's a perfect segue, what Domino was saying, into my topic here. Good morning, everyone. I'm here to talk about the importance of asking for help. You all know that a breast cancer diagnosis can be extremely devastating and overwhelming. Cancer doesn't care about the other challenges that women face in their lives. And a lot of the women I've met with breast cancer are these incredibly strong women who I often hear them say they don't want to be a burden to their friends and family, or they want to, deal with this on their own. And if you've ever thought that, or you're thinking that right now, this is for you. While it is important to keep people close to us, our friends and family, as support people while you're going through treatment, oftentimes the role of social services is downplayed, and usually it's because either women are too afraid to ask or they just don't know what's available. So I'm going to go through services that we have at Bellevue Hospital, as well as some of the resources out in the community. So at Bellevue we have a oncology specialized psychologist. We started she's available to see any patients that come into the breast clinic. We started doing very short screening questionnaires for depression for every patient that walks into the clinic. So obviously if there's any concern about depression or anything like that, those patients get referred to her. Based on her initial assessment, she determines whatever appropriate intervention has to happen. Sometimes that means short or long-term psychotherapy, medication management, referral to more emergent services, or just linking patients up with outpatient community mental health clinics. And I just want to make a point here, there's a lot of stigma attached to psychological and psychiatric services, but really she is just another member of your healthcare team, and she's just another person there to support you. So really anyone can ask to see her. And I apologize about this. Bellevue had a nutritionist, and I just learned that she left us between me submitting my slides and today. So I'm glad that the nutritionist was here today to talk about what resources are out there. And I just wanted to mention, not only is it important to eat healthily before, during, and after treatment, but a lot of cancer treatment can also affect your nutritional status. So a lot of women, experience nausea, vomiting, diarrhea through treatment. They have difficulty swallowing as well sometimes. So, there's a lot of resources out there, not just through nutritional services, but some of the big organizations like Cancer Care, American Cancer Society, Livestrong has great resources on their websites as well. And then I will skip this slide because you just heard about all the great resources that NILOG provides at Bellevue Hospital. We're very lucky to have them. And this was also mentioned, the importance of physical activity, but Bellevue has both a yoga and massage program during breast clinic hours on Monday. Licensed masseuses, yoga instructors come in, work with the patients, and both yoga and massage have been shown to help with fatigue, pain, sleep, and overall improvement in quality of life. Bellevue also has an artist in residence program where an artist comes in and helps women create different art projects. And this is really great because women feel like they're creating something, that they're more than just their diagnosis, and it can also help with distracting them from what's going on, whether they're having pain or anxiety about their diagnosis. So you're going to hear a little bit more about our breast outreach and navigation program later, but I just wanted to mention that we have 3 dedicated patient navigators in the clinic from different organizations such as Avon, SHARE, and American Cancer Society. and they just do incredible work helping the patients with everything and anything. And so patient navigation is there to help remove any barriers that patients are experiencing to getting their care. So that could be helping them make doctor's appointments, helping them get transportation, medical translation, you name it. They are there to help. So moving on to some resources in the community, Cancer Care is a huge organization that has so many resources, some of which are listed here. So they provide counseling, one-on-one counseling, as well as group support groups, and these are run by oncology specialized social workers. And so they can also help patients get services like home care, transportation, helping them apply for Social Security, disability, other forms of assistance. And both the individual counseling and support groups are available online, over the phone, or face-to-face. Cancer Care also provides a lot of free educational workshops, and they also provide financial assistance for a number of those things like transportation, home care, child care. They help with certain kinds of medications that patients are on, like pain medication, anti-nausea medicine, lymphedema supplies, and they also help with co-payments. Whoops, sorry. Most of you have heard of the American Cancer Society, also a huge organization that has a lot of resources. One of the things that American Cancer Society has that's great is called the Hope Lodge, which provides free lodging for cancer patients being treated in Manhattan. Obviously, it's kind of a limited service, so there's eligibility criteria, but it is great for patients who live very far away and have to travel far distances to get their treatment. American Cancer Society also has the Look Good, Feel Better program, which I should mention should fall under Bellevue Hospital as well. They do this at various different sites, but Bellevue is one of them. And this is a program that helps women cope with appearance-related side effects by teaching them beauty tips, makeup application. They provide free cosmetic kits, and these are run by licensed cosmetologists and estheticians. They also provide free wig consultations, and also given accessories like hats, scarves, turbans, that sort of thing. And the Reach to Recovery program is a one-on-one breast cancer survivor support program where they help women who've just been newly diagnosed. And then in terms of financial assistance, the Cancer Financial Assistance Coalition is really great because it's a huge database. So you go online on their website and you type in anything that you would need help with, such as rent or utilities, and then it kind of spits out all the different funding and grants that are available that can help with that specific thing. So that's a great resource. And then I just added here 2 funds that are grant-based in New York City, and it provides financial assistance for women who are unable to work through their treatment, and it helps with basic necessities of life like rent, utilities, food, transportation, car payments, car insurance, that sort of thing. Food-wise, there's a great program called God's Love. This is a food delivery program to people who are too sick to shop and cook for themselves, and this is great. They have a cancer-specific program where they have a team of registered dietitians that are designing those meals, and so they really take into consideration that these patients are undergoing either radiation or chemotherapy treatment. Most of you have heard of Meals on Wheels. This is a program that delivers a meal a day to residents that are at least 60 years old with some sort of medical disability, preventing them from doing the shopping and cooking. And then I just included here, the Human Resources Administration has a list, a very full list of all the food pantries that are available throughout the city. And then transportation-wise, I'm sure you've all seen the Access-A-Ride shuttles. So those are shared ride door-to-door transportation. You're eligible if you have a qualifying medical disability that prevents you from using public transportation. And our navigators have used that program a lot. The MTA also provides half-fare Metro cards. I think you have to be 65 years or older, but also with a qualifying medical disability. and that's a great program. And then American Cancer Society has Road to Recovery, which is a volunteer-based program, so they have drivers who volunteer to take patients to and from their treatment appointments. And moving on to support groups. So, support groups are really important because who knows what it's like to have breast cancer than someone else who has breast cancer. And obviously, everybody's very different, but I think it's very valuable in sharing, what the similarities and differences that women are going through. So SHARE is a huge organization. I just met a representative from SHARE outside, and she had all of her resources there, so please pick one up. Their mission is to create and sustain a supportive network and community of women affected by both breast and ovarian cancers. Their services are all free. They conduct their services in many different languages. And the nice thing about them is they have a lot of culture-specific support groups. So they have one for women of African descent, one for African American women, one for Latino women, Japanese women, you name it. They also have diagnosis-specific support groups, so women with DCIS or metastatic breast cancer, they have support groups for those women as well. They also provide free educational programs, and they also provide a clinical trial matching service. The other huge support group network in our city is the Gildas Club, which does a lot of similar work. They have a very extensive network worldwide, but the New York chapter is very active. They do a lot of networking, support groups, workshops, lectures, and social activities. They also have a research and training institute, which really focuses on doing research to improve the patient experience. And these are just some miscellaneous services. Medications, obviously really important. We know cancer drugs are incredibly expensive. So Partnership for Prescription Assistance is another one of those large databases where you go in and you type in whatever medication you're on, and it spits out maybe other affordable ways of getting that medication. We talked about the WIG program at Cancer Care, American Cancer Society, and then prosthetics. So Cancer Care has a great prosthetics program that provides 2 mastectomy bras and a breast prosthesis free of charge. The Lymphedivas program provides affordable, low-cost lymphedema sleeves. And then the SafeLink Wireless program is a government benefit. So if you are on any other types of government assistance like Medicaid, SNAP, food stamps, then you qualify for a free cell phone with prepaid service, which in this day and age is pretty essential to navigate life. Fertility is something that a lot of people don't talk about, but really important in our patients that are younger, who hope to have a child someday. And Livestrong has a great program that provides fertility preservation discounts, so discounts for ovarian stimulation medications as well as storage. And then finally, Sloan Kettering has a great immigration health program. They provide medical translation, case management. They do a lot. They put a lot of effort into trying to get immigrants and minorities into clinical trials. And they also provide primary care, post-treatment, as well as medically tailored food pantries. So that's a really great resource as well. So I want to end here with another quick survey. Oh. I think it's open. Oh, now it's going. Perfect. Most people are correct. Anybody can ask for help. It doesn't matter whether you've just been diagnosed, whether you are 5 years, 10 years out, whether you're a caregiver, but you don't know if you don't ask. And this is by no means an exhaustive list of resources. This is just a little sampling. And I'm fortunate enough to work with some amazing patient navigators who are extremely savvy and resourceful. So you'll hear about them later, but please feel free to reach out if you have any questions or need any help finding other resources. And I hope that just by sharing this with you today, that you feel empowered in knowing that things are available, that anybody can ask for help, and that you can either utilize or share these with your friends and family. And I just included a list so that it's easier to access for you. And that's it. Thanks.